So this all about type 1. And type 2 is what? Type 2 is this type. Your body does not make enough insulin, and your body cells don't respond normally to insulin. That means insulin resistance. Yes, this is the most common type of diabetics. It's mainly affect adults, but children can have it as well. So basically, if we talking about type 1 and type 2 diabetics difference, so we can see clearly that type 1 is this kind of diabetic which is basically cause of they can't able to produce proper amount of insulin, and type 2 they are producing insulin, but due to some reason our body can't able to absorb this kind of glucose and all. And who are facing this problem? Basically, in type 1, children, young category people are facing this disease, and type 2 means is aged person. I mean, more than 40 or like this kind of people who are facing this kind of problem. So here one term is coming, that is with which is related to type 2 diabetic, that is insulin resistance. Let me clear you the term. Insulin resistance meaning it is a complex condition in which your body does not respond as it should to insulin, a hormone your pancreas makes that's essential for regulating blood sugar level. Severe genetic and lifestyle factor can contribute to insulin resistance. With insulin resistance is also known as impaired insulin sensitivity. Happens when cells in your muscles, fat and liver does not respond as they should to insulin, a hormone your pancreas makes that's essential for the life and regulating blood sugar level. Insulin resistance can be temporary or chronic, and it is treatable in some cases. Okay, so this is the basically meaning of insulin resistance. Now another type, that is this is the basic difference between type 1 and type 2, as I am clearing with you. Next, some other type I am discussing with you, that is actually pre-diabetic. What is pre-diabetic? I'm going to the previous slide where I'm showing you the different types of diabetics. So once again I'm explaining this here. Pre-diabetics, it's just a types, is a stage before type 2 diabetics. Your blood glucose levels are higher than normal but not high enough to be officially diagnosed with type 2 diabetics. Okay, this is pre-diabetic condition. Next is gestational diabetic. Gestational means pregnancy time actually. The types developed in some people during pregnancy. Gestational diabetics usually goes away after pregnancy. However, if you have gestational diabetics, you are at higher risk of developing type 2 diabetics later in life. Another types of diabetics is also there, like type 3C diabetics. It is a form of diabetics, happens when your pancreas exercises damage other than autoimmune damage which affect its ability to produce insulin, like pancreatitis, pancreatic cancer, hemochromatosis can leads to pancreas damage that cause diabetics. Having your pancreas removed also result in type 3C diabetic. Next one, LATD, that is latent autoimmune diabetics in adult. It's like type 1 diabetics. LADA also result from an autoimmune reactions, but it develops much more slowly than type 1. People diagnosed with LADA are usually over the age of 30. Okay. Next is MODY, that is maturity onset diabetics of the youth. It's also called monogenic diabetic, happens due to an inherited genetic mutation that affects how your body makes and use insulin. There are currently over 10 different type of MODY. It's affect up to 5% of people with diabetes and commonly runs in families. Okay. Next one is neonatal diabetics. This is a rare form of diabetics that occur within the first 6 months of life. It's affect a form of monogenic diabetic. About 50% of babies with neonatal diabetic have the long life form called pre-manic neonatal diabetic. For the other half, the condition disappear within a few months from onset, but it can come back later life. This called transit neonatal diabetic mellitus. These are the another types of diabetics.